So going back to I find this interesting. Your brother was an optometrist. You decided to become an ophthalmologist. Throughout both of your careers, what was that duality like?
It always worked very well. We have always kept our professional careers pretty much separate. Although one of the things he did as he became more of an academic optometrist, in other words, an instructor, and eventually he became an administrator. Became administrator, director of the outpatient clinics in optometry down at Ohio State, and then became the uh, the dean of the College of Optometry at University of Alabama, Birmingham, and was there for a number of years, and then became the president of the Illinois College of Optometry up in Chicago, and was there for the remainder of his career, just also retired about the same time I did.
Oh, okay.
He would occasionally ask me to come down and actually do video things like this at a much earlier stage in development of the process, but where he would just ask me about various things that he found that the residents would often want to know. Their trainees, their optometry trainees would want to know, and he would just ask me these questions, and I would more or less expound on what I knew about those things and what you needed to tell patients, what you needed to look at. And so I did that. One of the things that I know there are some in ophthalmology who want nothing to do with optometrists because they see them as the enemy. From my perspective, especially having a brother in optometry, my perspective was we have optometrists. We are not going to legislate them out of existence.
Right.
And so we want to have the optometrists trained as well as they can be.
I agree.
So I would provide these kinds of services to them to allow them to then look at those things and maybe learn in a different way than just reading textbooks. So that's kind of how I've interacted with it. Other than that, our clinical careers took very different courses. As I say, he became an administrator. He was very influential while he was in Ohio as a person who would talk with the legislators and be involved in various kinds of committees that the legislature would have, where they would talk about, driving safety and what are requirements for driving, and they did practical things. Well, I didn't have time for that. Yeah. Also, I should add, this is a real difference that I saw, because he, as an administrator, gradually had more and more time to develop policies and talk with, again, legislators and other influence makers, and that was his almost full-time job. Whereas by the time I got to the position of being a department chairman, I had a full-time clinical practice that I had to maintain, plus try to develop policies and procedures and organize the department and get the various people on the staff working in a positive direction. But I didn't have the kind of time that he and other optometrists have to devote toward those things. I was not able to go out and visit with all of my legislators. Right. He learned at the age of, I think, about 50, how to play golf. And he loves golf now. And he gets out there and he plays with all these other influencers. And we don't get a chance to do that.
Right.
And, the few people we have in administrative positions in the American Academy of Ophthalmology do not compensate for that lack of grassroots involvement that the optometrists have.
Yeah. I have to agree with you. I think before entering ophthalmology residency, I heard so much about, this clash between ophthalmology and optometry. But quite frankly, my experience has been nothing but positive. I've seen the CEI model. We have optometrists who work at CEI. We have optometrists who are built into our residency curriculum who help teach us At the VA where we rotate, there's optometry residents we work side by side with. CEI has a couple of optometry residents. All the optometrists I've worked with have been fantastic, and especially as a first-year resident, I learned quite a bit from them because they went through optometry school and focused on the eye, and I went through medical school and focused on the whole body. But it's interesting that we're at this point where the academy is considering, I think, bringing back optometrists into the fold, and there's been a lot of reactions one way or another from the ophthalmology community. So much so that I think was it Connecticut? There was some survey that was sent out earlier this year where they surveyed ophthalmologists, and I think the question was, should optometrists have AAO membership? And there were a few questions asked, and there was something like 100 or 200 comments listed. And I went through and I read every single one, and they all were variations on two things. One was absolutely, like we're saying, optometrists are our colleagues. They're an integral part of providing eye care. There's not enough ophthalmologists to go around. The number of ophthalmology residency spots really hasn't changed significantly in the past 30, 40 years. So if we're going to provide quality eye care to our country, we have this collaborative model, and absolutely optometrists should have membership or access to these sort of quality conferences and lectures and didactics that we're experiencing. And then the other side seemed to say, we agree with that, but there will always be a vocal minority, or there'll always be a few who really try to take it and run with it and either try to do surgical procedures that they're not trained in, that sort of thing. So it's interesting that I keep hearing about this sort of stuff, especially on the legislative front from a policy perspective, but on a day-to-day basis, at least personally, I haven't had any negative interactions with optometry at all. And it's always interesting speaking to someone who has a close connection, who has a brother who's an optometrist, or like Dr. Linzel, who was an optometrist before going to medical school and then becoming an ophthalmologist. I find that very fascinating because there's other areas of medicine, right, where you have nurse practitioners or mid-level providers who are the model is kind of similar, but not quite. It's a little bit different for us, but it's going to be interesting to see what happens.
It will be interesting, and again, my opinion is my opinion, so it really doesn't influence anything at all. As I said before, we are not going to legislate optometrists out of practice. They have much more influence than we do.
Yes.
Though, with the legislators, because they know them. They live in their communities. They go to the various kind of civic groups that have their lunches in the middle of the day. We can't do that. And so we're at a disadvantage, even in the administrative levels. So when I was the department chairman, I didn't have the time to do that. And certainly, I still maintain unlike my brother who plays golf with these people, I still maintain my track record of never being on a golf course except for a wedding reception.
Wow, that's pretty crazy. You've never been on a golf course apart from that.
Except for things like
wow.
that.